Good morning, everyone, and welcome to Munson Healthcare's COVID-19 press conference. I'm Diane Mihalik. I'm the Chief Marketing and Communications Officer with Munson Healthcare, and I will be your host today. As a reminder, in addition to these press conferences, you can stay connected to Munson Healthcare and the latest COVID-19 information by signing up for our e-newsletter, following us on social media, or visiting munsonhealthcare.org. Next slide, please. So today I'm pleased to welcome back Dr. Christine Nefce, who's the Chief Medical Officer for Munson Healthcare. We'll also be welcoming back Wendy Hershenberger, who's the Health Officer for the Grand Traverse County Health Department, as well as Dr. Jennifer Morse, the Medical Director of District Health Department number 10, and also Heidi Britton, the CEO of Northwest Michigan Health Services. Today is Tuesday, July 6th, and let's get started. We will first receive an update from Dr. Christine Nefce, who's the Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefce.
Thank you, Diane. It's great to be back. Let's go ahead and get started with the numbers. We continue to have really good news in our Northern Michigan communities. Over the long weekend, we really only saw an increase here, you'll see, of 6 cases. So our percent positivity rate and cases per 100,000 continue to be quite low. We, in fact, for the last 14-day average are below 1% on our percent positivity. So really good news, 15 cases per 100,000. So that makes me very happy. Next slide. You can see too, we continue to have a handful of patients hospitalized with COVID-19. We actually have 4 inpatients across the Munson Healthcare system as of this morning. Next slide. And there you can just see the graphic presentation of our surge and the downward trend and kind of where we are right now in a steady state. Next slide. I am also happy to present or to say, even though we've had a slowdown in the number of vaccines we've given over 86,000 doses. And that again is in combination with our mass vaccination clinics, our primary care providers throughout the Munson Healthcare system, and a great partnership with our local health departments. Next slide. Here you'll see the state's vaccination coverage. We're at 56.5%. And again, this is with 1 dose initiated, and you will see some different numbers sometimes. This is just in our MICR database, but there's also the VA Department of Defense and some of our residents who've gotten vaccines in other states. So when you see some of the news with a higher percent positivity, percent of vaccine covered, that's where that other data is coming in. But this is from our own MICR database. And then if we'll go to our region here, we're at just over 60% of our patients covered. You'll see Leelanau County there is a different color because they have an even higher percent covered, and congratulations to them. Next slide. So we are hearing quite a bit on the news about the Delta variant. We had currently, actually this is a little bit dated, last week they've estimated that we've doubled that 10% to 20% of new cases in the United States are the Delta variant. We saw similar type of trend from the UK, where now over 90% of their new cases are the Delta variant. So we are expecting to see sort of the same trend here in the United States. As a reminder, this is the variant that has multiple mutations. We know that compared to the wild type, which was the original form of this virus, that the alpha variant, which was also formerly known as the UK variant, was about 50% more transmissible. What we know about this Delta variant is that it's another 40 to 60% more transmissible than the alpha variant, so highly contagious. We are also seeing some preliminary data that shows us that the Delta variant infection does tend to cause more hospitalizations and more impact on respiratory illness for folks. So a little bit concerned about that Delta variant, but we are balancing that with our high rates of vaccination There are some, again, preliminary data coming out of places like Israel and some other countries that show a slight reduction in the efficacy of vaccines against the Delta variant, but still, considering how highly effective those vaccines are, it's still good. So maybe, between 1% and 6%, but that is something that we continue to follow as we see more news coming out from countries where there's a higher prevalence of that variant. So we are monitoring that, watching the data, but again, a really good reminder that we are not out of this yet. There's still some reason to be concerned. You'll see there are some countries, in fact, some states that are dialing back. They're opening up a little bit because of the Delta variant, and the World Health Organization is recommending people mask in crowded areas because of the contagiousness of this particular variant. Next slide. We also continue to offer our monoclonal antibody therapy. We did make an adjustment in the medication that is used in that one because of the prevalence of the Delta variant. So it is certainly protective of that as well. But as a reminder, patients 12 years or older with mild or moderate symptoms of COVID-19 and a positive test can come for a one-time outpatient infusion of monoclonal antibody. It is available across our Munson Healthcare region in Traverse City, Kalkaska, Grayling, and Cadillac. And again, this is really useful for people that are at high risk of developing more severe illness from COVID-19. We administer it early on, so within 10 days of your diagnosis and or onset of symptoms. If you have questions, you can contact your primary care provider, or as always, you can call the Munson Healthcare Ask a Nurse line and discuss with them what your options are. Next slide. And again, I mentioned already, but the COVID-19 vaccine is safe, it's effective, and as we start to see this new variant take a foothold, not only in the United States, but in our state, just really reiterating the importance of getting vaccinated as a preventive, not only for yourself, but for those around you in your community. If you have questions, again, your primary care doctor knows you the best. Please talk to your primary care provider. If you want a second opinion or you don't have a primary care provider, you can always call our Munson Healthcare Ask a Nurse line.
Thanks, Dr. Nefce. We appreciate that update, and we will have you back shortly for a Q&A session. As a reminder, if you are a reporter actually on this Zoom call, you can submit your question through the Q&A feature. If you're watching us live on Facebook, please feel free to submit your questions there, and we'll get to as many as we can in our 45-minute time slot today. But moving on, I would next like to welcome back Wendy Hershenberger, who's the health officer for the Grand Traverse County Health Department. And as a reminder, Wendy does not have the video capability, so we'll just be hearing her voice today. Welcome back, Wendy.
Thank you. Good morning. So Dr. Nefce did a great rundown of numbers, and in Grand Traverse County, we also are seeing very low numbers. So we've had, I think, 3 cases reported in the last 7 days. But I will say that testing numbers are down right now as well, which could be because people aren't sick, which is great. Also could be because people aren't getting tested if they are sick. So particularly if you're unvaccinated and you start to have any symptoms, really think about getting tested, particularly after this last kind of holiday and the festival that's going on. There's a lot of people that people are around right now. And so testing is always a good idea. If you either hear of an acquaintance or think you may have been near someone who is exposed or who has the virus. And also our numbers reflect what our numbers are for our residents. And so we do have a lot of visitors coming from out of the area. And so we do not know what areas they're coming from necessarily. Maybe if they're friends of yours, you might, but if you're just out and about in big crowds, you don't know where they're coming from. So if you're not vaccinated and definitely having symptoms, we encourage you to get tested. You can get tested at most primary care providers, most urgent cares. At health department here, we have testing on Mondays and Wednesdays. It is at our main health department building, but it is in the back of the building. There's we actually test you in your car, and there's a carport that you can pull into, so you're out of the heat and the sun while you wait for your results. And we give you those results. You also get them electronically, and again, Monday and Wednesday. Also just want an alert to parents as you're starting to think about back to school. I know we just got out of school, but a lot of athletes are thinking about when sports practices start up later in the summer, or sports camps. So now's the time to be thinking about getting your athlete vaccinated if they haven't been yet. So they'll be fully vaccinated by the time they start some of the more intense practices. So if you get your first dose this week, they would be fully vaccinated by the week of August 16th. Next slide, please. Here's where we're doing vaccinations this week. We have, we're at the Cherry Festival. We were there this weekend, actually featured on MSNBC Live, which was a nice little plug for us. So we are there today, Wednesday, Thursday, Friday, and Saturday. So basically every day the rest of the festival. Hours vary a little. You can see the hours here, and we'll have that on our website as well. But certainly you can stop. We are offering Johnson & Johnson, Moderna, and Pfizer, so all three. Some people maybe just need their second dose and stop by, so we can accommodate first or second doses, or just the one-shot Johnson & Johnson. Next slide, please. And then our normal standing vaccination clinic is at the Cherryland Center, which is at the corner of Garfield and South Airport. And so we have hours today there. Tuesdays are 11 to 6:30 p.m. and then Thursday from 9 a.m. to 4 p.m. So a couple different sites for people to get vaccinated. And just a reminder that the 12 to 15-year-olds do require a guardian present. The 16 or 17-year-olds who might be able to drive themselves there, we actually do require consent from the guardian, but they don't have to be present. Next slide, please. And just showing the vaccination progress for Grand Traverse County. So we are at over 68% for an initial dose. So we're slowly creeping up to that 70% number. 64.5 have completed, so that's great as well. And then you can see our vaccination coverage by age group, and see that the 50 plus group are over that 70% threshold. And then we're still working on getting the rest of the age groups up to that number. But the 16 to 19-year-olds are really, even though they were one of the last to be eligible, they're really pushing the numbers, which is really good to see, and hoping that the 12 to 15-year-olds continue as well throughout the summer before we get back to school. So that's where we stand in Grand Traverse County.
Great. Thank you, Wendy, for that update. We appreciate all the hard work you and your teams have been doing, especially during the National Cherry Festival. So those are great numbers to see. We'll have you back shortly for the Q&A session at the end of our panelist presentations. But next, I would like to welcome back Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Welcome back, Dr. Morse.
Thanks for having me. I don't have a lot of new information today. We've hit 103,000 vaccines total given in our 10 counties. We have integrated our vaccinations into our regular vaccine clinics. I apologize, our slide didn't get updated very well this week. So we don't have walk-ins anymore on Tuesdays and Fridays. We've integrated those into our regular vaccination clinics. So just focus on the red box there. You can call our central scheduling, the 888 number, to set up an appointment, or go to dhd10.org/schedule. You can call ahead to see if there is a nurse available as well in our office and come in for a walk-in vaccination. We have numerous different pop-up clinics available, and those are at our events page. And if you are interested in having us do a pop-up clinic in any of your events or workplaces or anything like that, just let us know. All of our different websites are listed there where you can find information about that. Our numbers in terms of cases are really quite stable. Many of our counties are seeing 0 cases. A few counties just see a few here and there. Again, like Grand Traverse, our testing numbers are quite low. You don't have as many sick people, you don't see as many tests being done, but still we worry that those that may have symptoms may not be seeking out testing like they should. So just a reminder that any symptoms whatsoever, don't just think it's allergies or something else. Make sure you're going to get tested still, because that's our quickest way to stop recurrences and outbreaks and surges again, is to make sure that we identify any cases out there. So that's really all I have for an update, and I'll stick around for the questions.
Great, thanks, Dr. Morse. Appreciate
Yeah.
that update and appreciate your continued efforts in your areas. Last but not least, I'd like to welcome back Heidi Britton, who's the CEO of Northwest Michigan Health Services. Welcome back, Heidi.
Thank you. Thanks for having me. Like others, not a whole lot of new to report. We continue to also provide pop-up clinics. Walk-ins are here at the clinic. We have a drive-up that you can do. Curbside clinics, definitely every Tuesday here in Traverse City. Today it's open. Basically, anytime anybody needs a vaccine, they can kind of come on in and ask for one, or call at the phone number to request one, making it as simple as possible. We still are not testing from other PCP referrals. We continue to do our own patients. If you come through and have a telehealth or a visit with our providers and they order a test, we can do it there. Otherwise, just making sure that we're out and about in the communities. We're doing up at the camps and the farms, different wineries, going to TC Latino, going to different grocery stores, just trying to get out there. And so if someone in the community has a need and would like us to be a part of it, please let us know, and we're happy to show up. That's all I have today, Dan. Thank you.
Thanks, Heidi. I'll have you stay on for the Q&A panel, and I'd like to now invite our other speakers back for the Q&A session. We do have a few questions coming in already. As a reminder, feel free to submit your questions via Facebook, or if you're a reporter, directly through the Q&A feature here. The first question is from one of our reporters, and I'm going to start with Dr. Nefce and then ask our health officials to also weigh in. This person is a reporter looking at the vaccination numbers statewide. The numbers have dropped dramatically from May now until June, and the numbers have also dropped at that's at a state level. The numbers have also dropped at a county level. How do you explain this, and what is the challenge going forward? So Dr. Nefce, you touched on this a minute ago, that we are seeing a decline in people wanting or getting vaccines. How do you characterize that?
Well, I think early on, when the vaccines first came out, there was a high demand for people to get vaccinated and get back to normal. And certainly, a big push to get those in sort of the high risk job categories like healthcare and others vaccinated. We are, as Wendy and others have shown, anywhere between 60 and 70% of people already vaccinated. And so that leaves, a smaller percentage of the public who is unvaccinated. Some of those folks are still biding their time. Others still have concerns that maybe haven't been adequately addressed, and some are just never going to get immunized. So, as we move forward, we just have a smaller pool to draw from. And we just continue to stress, the safety and efficacy and importance really for all of us as a community to get broad, high rates of immunization so we can all get out of this pandemic.
Thanks, Dr. Nefce. And next I'll go to Wendy. Wendy, you've actually had pretty strong numbers throughout the last few months as well, comparatively to some other areas of the state. Do you have any concerns or any challenges you're seeing?
I don't know that we have any, actual challenges in delivering the vaccine. It's more just finding people right now who are eligible for it and want to get vaccinated. I will say it's really important though that as adults and those who are eligible to get vaccinated, that we do try to overachieve that 70% number and try to get higher, because we still have that 0 to 11 age group that isn't protected. And so the higher we can get in the other age groups, the more we can protect the children as well.
Thanks, Wendy. Dr. Morse, any additional comments from your region?
I think we just have a certain percentage of individuals who, when we have surveyed them, because we actually did recently do a survey, there's about 30% of individuals that have not gotten the vaccine, and of that group, 30% of them said that they will just never get it. So I think we're just working against a group that just can't be convinced to get the vaccine at this point, and we really can't find any reason or any way to really change their mind. And we really just have to keep working to provide every opportunity to get every other individual vaccinated. But again, if you look at everyone 12 and above who's eligible to get vaccinated, if you can only vaccinate 60 to 70% of that group, you can only hit a certain percentage of the population then, even if you vaccinate every single person who says they're willing to get vaccinated. So you can only do so well with those limitations.
Thanks, Dr. Morrison. Heidi, I'll let you weigh in as well, because I know your team has done a tremendous amount of work in actually trying to fill some of the gaps in coverage and making sure that you're going to the people, just like the rest of the health departments are. What are you seeing right now as far as hesitancy and any challenges?
I think that the areas that we're hitting, we're finding that they maybe never would have went to get the vaccine anywhere else. So I get more of that versus the hesitancy, because they were like, oh, this is convenient, I'll just get it now. Kind of always wanted it. I wasn't 100% sure. And then we'd have, our medical personnel kind of chatting with folks, and our nurses just really talking to folks about the vaccine. And it's been, we've seen a lot of positive come out of just moving the vaccine to folks. More than challenges. Really good, warm, fuzzy stories out there of people driving by and bringing food and supporting our teams who are on the buses, to just thank them for just being out there and having the vaccine and bringing it to them. So we've seen a lot of positive from just bringing it out to folks.
Great, thanks, Heidi. Next, I'm going to first ask this question of Wendy, and then I'm going to have Dr. Nefce weigh in as well. Wendy, I think the biggest event in Northern Michigan right now is occurring with the Cherry Festival, drawing people from all over the world to Traverse City. When would we potentially see a spike in cases as a result of, possibly as a result of that activity? Are you tracking that, and when would you expect to see, and are you expecting another surge because of this?
Okay, so 3 questions in one.
Sorry.
Yeah. So I would say that we definitely do expect to get a surge at some point, I think, whether it's this summer or maybe in the fall, once people start moving more indoors again, and then also watching the Delta variant. So there's a few factors at play there. So we know we will get some blips. If we were to see an increase in cases from the current events, it would be within the next couple of weeks. I would say if we watch the next 2 to 3 weeks, depending on when somebody was at an event. We might not see all the cases though here, because we're going to get reports of people who are residents of our counties in this area. So we may see a little bit of a blip here, but there may actually have people from other states or other counties that see an increase as well. So we might not know the total impact of that. Did I answer all 3 of your questions?
You did, Wendy. Thank you. And sorry, I threw 3 at one time. Dr. Nefce, from a hospital and a healthcare system perspective, what are you planning for?
Well, I think we're, looking at what's going on in other places, and understanding, as Wendy said, that it's a very real possibility that we would see another surge with the Delta variant. Again, we are optimistic about the level of vaccine coverage we have here in Northern Michigan, but it's not, where we need it to be. We still have a significant portion of the population, either by age or by choice, that is not vaccinated. So we are prepared, as we have been across all of our Munson Healthcare hospitals, to take, an influx of patients. We still continue to track it every day. We huddle on it every day. We report it out. You know, we are ready if it happens, hopeful that it won't, or at least that it'll be a muted surge given our vaccine rate. But, you know, we're prepared for whatever happens. Just trying to encourage people to please get vaccinated, as that is really the way to prevent more spread.
Thanks, Dr. Nefce. The next question is also for you, Dr. Nefce, and it's a question about a trending story in the media right now about COVID-19 long haulers. Is there anything new that we know about that condition or any treatments that might be available?
Yeah, you know, that's a really interesting one. I think people are calling it now post-acute SARS-CoV-2 syndrome. And what we know is that fully a third of people who get COVID-19 will develop a symptom of long haulers. So that's a third of people, regardless of whether you had illness severe enough that you required hospitalization, or it could have been quite mild and you never even went and saw your physician. And, you know, the symptoms are pretty varied. It can be anything from, you know, severe fatigue to dizziness and lightheadedness. You'll hear people call, you know, brain fog, but really a lack of ability to concentrate and focus, heart palpitations, chest pain, shortness of breath, a pretty broad range of symptoms. There's unfortunately no real treatment. I mean, certainly if you had sequelae from COVID, like, you know, renal failure, there's treatment for that. But for the other symptoms, there's really not true treatment. What there is, you know, physical therapy and other kind of support, sometimes behavioral health support, sometimes other, to help you deal with and manage your symptoms. It's such a varied range of symptoms. It kind of just depends. So, you know, some things there are clear treatments for and others not. So we are really in the process now of trying to support our primary care providers in identifying and managing and being able to refer those patients appropriately when necessary, but supporting them in their recovery.
And is there any way to know, or are there any health indicators that someone would develop more of a long hauler type syndrome than others?
Yeah, unfortunately not. I mean, that's what you would think if you had severe illness, that would be the reason that you develop it. And that does not appear to be the case. So there's really no rhyme or reason, you know, just like there's not really a great way for us to predict who will get significant COVID disease and who won't. It's the same with this post-acute syndrome. There's really not a way to identify who's at risk.
Great, thanks, Dr. Nefce. This next question is also for, I'll ask Dr. Nefce first and others can weigh in, but what mask guidance would you give someone who is unvaccinated, and what about children?
If you are unvaccinated, you should be wearing a mask, especially if you are indoors. So, you know, whether you're at Meijer or you're at a restaurant or whatever, if you are not vaccinated, 100% you should be wearing a mask. I'd say the same for children. If they are not vaccinated, they should be wearing a mask. You know, there are the World Health Organization is actually, because of the Delta variant, saying even if you're vaccinated, you should be wearing a mask in crowded spaces. And if you're unvaccinated, you know, there's a lot of, well, I'm outside, I should be fine. But if you're in a crowded outdoor space, like Cherry Fest is a good example, you should be wearing a mask if you aren't vaccinated. You still are at risk for getting this illness and spreading it. And again, even with the Delta variant, there are asymptomatic people that are infected. And this is, again, a highly contagious variant. We have children and other high-risk people in our community. So you should be wearing a mask if you are not vaccinated.
Thanks, Dr. Nefce. We do have another question coming in asking if there are certain demographics of people that we're seeing who are most vaccine hesitant. And I know that Wendy touched on this a little bit earlier, just showing and I wouldn't necessarily say that the graph you showed showing the age groups of people being vaccinated, if that was low, that doesn't necessarily correlate to someone who's vaccine hesitant. It could just be they haven't gotten around to it yet. But you know, I think we're still seeing, and correct me if I'm wrong, but it's more in that 20 to 30 age group. Is that still true, Wendy or Dr. Nefce?
It's true that they're at a lower percentage of vaccination.
Yeah, right.
But what you talked about first, yeah, we haven't surveyed our population, so it would be hard to say. I think they're likely not necessarily totally opposed to getting vaccinated. Either they just don't think they need to yet, or it's just not convenient for them yet.
Right, right.
I do think there's definitely vaccine hesitant in all age groups, however.
I would agree with that. So thanks for that question. Dr. Nefse, could you touch on whether or not we know any more information on if and when we would need a booster shot?
Yeah, it's a great question, and one that continues to be studied. So, I think we've talked about this before, but the original people that were part of these vaccine studies are still part of the vaccine studies, and what they're looking at now is they're just doing serial tests on their antibody levels. As of the last data I saw, the response is still good. At about 9 months out, but it's certainly something that is of concern and something that we continue to follow and test. So, there are some vaccines that require boosters, and there's a wide range. So with a flu shot, we change that on an annual basis. Things like tetanus are every 10 years. It just really depends. And so it's something that continues to be looked at and studied. And we, as well as I think the vaccine manufacturers and the state and at the federal level, are ready, to bring out booster shots if necessary, as soon as we find any information that would indicate that that's appropriate. Diane, you're on mute.
Thank you. Still haven't learned that yet. Dr. Nefse, one more question for you related to mRNA vaccines. We have heard that there are some people who are hesitant to receive the mRNA because they still believe it is either unproven or new technology. Is there any new information on that, or anything you'd want to share with someone who would be hesitant in getting an mRNA vaccine?
Yeah, and again, we've said this before as well, but the mRNA vaccine technology is actually not new. It's quite expensive, and so there were a lot of studies and preliminary work done on mRNA vaccines. I mean, even with the SARS, which you'll remember was in the early 2000s, they started then doing research particular to coronavirus, but on these mRNA. So, the technology is not new technology. But with this pandemic, there was huge support financially and otherwise. A lot of money got input into the development of these vaccines. So that really was, I think, the tipping point to support how expensive the research was to get these vaccines developed. The other thing that I would say is, we've been vaccinating now in the United States since the end of December. And so we've got a solid 6 months of data, in the general public, let alone all of the studies that were done prior to that, that show the efficacy and safety of these vaccines. So it's not new. It's safe, and we have just more and more data as time goes on to support that.
And Dr. Nefse, one more question related to the hospitalization inpatients across our healthcare system. Are those mostly unvaccinated individuals?
Mm-hmm. They
are. Okay.
Mostly, vast majority, over 90% are not vaccinated.
Okay, so I think the main point is there's still time to get vaccinated. We are still tracking this Delta variant. I don't see any additional questions coming in from either our Facebook viewers or our reporters. So I would just like to thank all of our panelists here. We didn't have any additional questions for Heidi or Dr. Morse, but we appreciate you joining us, and Wendy, as always, appreciate your insights. Just as a reminder, there are some community resources still available on the Munson Healthcare website and through all of these different links and phone numbers, including the 211 Michigan, the Area Aging Agency on Aging of Northwest Michigan, Northwest Michigan Health Services that we heard from Heidi, Grand Traverse County Health Department, where we heard Wendy's update. Lisa Peacock was not able to join us today from the Health Department of Northwest Michigan and Benzie-Leelanau District Health Department, but you can always get updates on vaccination availability and testing sites by using those websites. And then thank you again, Dr. Morse from District Health Department number 10, and here's your contact information. So again, lots of great resources out there. Again, there's plenty of places to get vaccinated if you still want to choose to be vaccinated, and as of course we encourage you to do so. So again, thanks everyone. In addition to, again, these press conferences, please sign up for our e-newsletter, follow us on social media, and visit munsonhealthcare.org. Thanks everyone and have a great day.
Thanks, Diane.
Thank you.